Hey, you cats and kittens. Just kidding. It's Dr. Vane here, and I wanted to put a little video out about our update of our dropping and going out of network with Delta Dental. Now, since we returned from the COVID closure, we have been telling all of our patients in person that by year end of 2020, we were going to be going out of network with Delta Dental. Now, what does that mean for you as a patient? It means we still take your insurance, we still bill everything, we know what Delta's going to pay and cover. But the difference is with Delta versus other insurances, they like to make the process a lot less seamless. Typically, when we bill out of network for other insurances, everything's just the same as it was before for you as the patient and for us as the provider. With Delta, they like for the check to be sent to the patient, which means that we would need to collect a bigger portion here up front. Now, the good news about that is that Delta will actually reimburse you as the patient from within 7 to 14 days, whereas we as the provider can wait up to 45 days and also have to submit several appeals. The other good news is that Delta's relationship has always been with you, the provider. We don't have a relationship with them other than that we will honor their contracted fees. So we recently had a case where there was a covered benefit of quite a large amount for the patient that said it would be covered. We submitted twice, got just flat out denials, called flat out denial. We instructed the patient to call, and he immediately got an apology from Delta, said, "We're so sorry, sir, this is our mistake," and started the payment process and reimbursed us and him. But they wouldn't have done that for us as the provider. They're much more willing to work with you as the patient. So that is great news, because the reason we decided to go out of network is that we got another letter this year that Delta is going to be further lowering their fees and not covering items that have been covered for the past 20 years of practice that I've been a Delta provider. And what's really discouraging about that is that our overhead is up tremendously, with the cost of gloves up 5 times, and the PPE and the extra, even our Cavicide wipes, the cost has increased 5 times in the past 6 months. So our costs are a lot higher, and it's ending up with their lower reimbursements. We actually aren't even reimbursed enough to cover our costs for treating the patients. And running a dental office, all I want to do is provide the best care and the most conservative care. And I really want to be aligned with an insurance that cares a lot about their patients like we do. So again, if you are in network with Delta, do not worry. You're still going to get things paid for. You'll get paid a lot sooner. You'll just be paying a little more up front initially when you come in for your visits. We'll be able to prepare everything for you in advance, so there'll be no surprises. And I think you're going to find that it's not as scary as it sounds. With all the other insurances that we've gone on a network with, it's been really an easy process. So wanted to take a moment and share that with you. Feel free to call the office if you have any questions about this or how it's going to affect your care. And I really want you to know that I appreciate and value all of my patients, and am grateful to be able to provide you with care.